If you have trouble turning on subtitles in your language, please comment. Today, we're diving into an important topic: diabetes symptoms and complications that are more common in women than men. It's crucial to understand these differences because they can impact how diabetes is diagnosed, treated, and managed. Let's start with the basics. Diabetes is a condition where your body has trouble processing glucose, or sugar, in your blood. This can lead to high blood sugar levels, which can cause all sorts of problems if left unchecked. Now, while diabetes affects both men and women, there are some key differences in how it shows up and plays out in women's bodies. First up, let's talk about symptoms. Women with diabetes often experience some unique signs that men might not. For example, vaginal yeast infections are much more common in women with diabetes. If you're a woman and you're getting frequent yeast infections, it could be a sign that your blood sugar levels are out of whack. But don't panic just yet, as yeast infections can have other causes too. Another symptom that's more common in women is urinary tract infections, or UTIs. High blood sugar can make it easier for bacteria to grow in your urinary tract, leading to these uncomfortable infections. If you are getting UTIs more often than usual, it might be worth checking your blood sugar levels. To minimize UTIs and yeast infections, especially for women with diabetes, there are several practical steps you can take. Control blood sugar levels. This is crucial. High blood sugar creates an environment where bacteria and yeast thrive. By keeping your glucose levels in check, you reduce the risk of both UTIs and yeast infections. Stay hydrated. Drink plenty of water throughout the day. This helps flush out bacteria from your urinary tract, reducing the risk of UTIs. Practice good hygiene. Wipe from front to back after using the bathroom to prevent bacteria from spreading to the urinary tract. Keep the genital area clean and dry. Avoid using harsh soaps or douches that can disrupt the natural balance of bacteria and yeast. Wear breathable underwear. Choose cotton underwear and avoid tight-fitting pants. This helps keep the genital area dry and less hospitable to yeast growth. Urinate frequently. Don't hold your urine for long periods. Empty your bladder regularly and especially after sexual activity. Be careful with antibiotics. While necessary for treating bacterial infections, antibiotics can disrupt the natural balance of microorganisms in your body, potentially leading to yeast infections. Only use antibiotics when prescribed by your doctor. Consider probiotics. Some studies suggest that probiotics may help maintain a healthy balance of bacteria in the body, potentially reducing the risk of yeast infections. Avoid irritants. Use unscented hygiene products and avoid bubble baths or other products that might irritate the genital area. Manage constipation. Constipation can increase the risk of UTIs, so maintain a high-fiber diet and stay hydrated to promote regular bowel movements. Be cautious with certain diabetes medications. Some medications like Invokana, Jardiance, Farxiga, and Steglatro can increase the risk of yeast infections. If you're on these medications, be extra vigilant about hygiene and discuss any concerns with your doctor. Consider topical estrogen. For postmenopausal women, using prescription estrogen vaginal creams may help reduce the recurrence of UTIs. However, this should only be done under a doctor's guidance. Remember, while these steps can help reduce your risk, they don't guarantee prevention. If you experience symptoms of a UTI or yeast infection, it's important to seek medical attention promptly. Early treatment can prevent complications and provide relief sooner. Also, regular checkups with your healthcare provider can help manage your diabetes effectively, which in turn reduces your risk of these infections. Now, let's move on to some of the complications that women with diabetes face more often than men. One of the big ones is heart disease. You might think that men are more at risk for heart problems, but when it comes to diabetes, women actually face a higher risk of heart disease than men do. In fact, women with diabetes are more likely to have a heart attack or stroke compared to men with diabetes. Why is this happening? Well, it's partly because diabetes seems to cancel out the natural protection that estrogen gives women against heart disease. When a woman has diabetes, her risk of heart problems jumps up to match or even exceed that of men. This is why it's so important for women with diabetes to keep a close eye on their heart health. Another complication that hits women harder is kidney disease. Diabetes can damage your kidneys over time, and women seem to be more susceptible to this damage than men. This means that women with diabetes need to be extra vigilant about their kidney function and work closely with their doctors to keep their kidneys healthy. Let's talk about something that affects quality of life, sexual health. Both men and women can experience sexual problems due to diabetes, but the issues are often different. For women, diabetes can lead to vaginal dryness, decreased libido, and difficulty achieving orgasm. These problems can be frustrating and embarrassing, but it's important to remember that they're medical issues, not personal failings. There are several things people with diabetes can do to improve their sexual health. Let's dive into some practical strategies. Communicate openly with your partner. Honest discussions about your concerns and needs can strengthen your relationship and motivate you to seek help together. Don't be shy about expressing your feelings and desires. Talk to your doctor. Many people feel embarrassed to bring up sexual issues, but it's crucial to discuss them with your healthcare provider. They can help identify underlying causes and suggest appropriate treatments. Keep blood sugar levels in check. High blood sugar can lead to nerve damage and reduced blood flow, which affect sexual function. Maintaining good glucose control is key to preventing these complications. Manage related health conditions. Keep an eye on your blood pressure and cholesterol levels. These factors can impact sexual health, especially for people with diabetes. Maintain a healthy weight. Losing excess pounds can improve diabetes management and boost body confidence, which may positively impact your sex life. Stay active. Regular exercise improves circulation, helps control blood sugar, and can enhance overall sexual function. It's a win-win for your health and your sex life. Address mental health. Depression and anxiety are common in people with diabetes and can affect libido. Don't hesitate to seek help from a mental health professional if needed. Explore new intimacy techniques. If intercourse is challenging, try expanding your range of intimate experiences. This might include massage, oral sex, or using sex toys. Consider medication. For men experiencing erectile dysfunction, drugs like sildenafil or tadalafil might help. Women might benefit from lubricants or vaginal moisturizers for dryness. Quit smoking and limit alcohol. Both can worsen diabetes symptoms and sexual function. Cutting back or quitting can have positive effects on your overall and sexual health. Manage stress. High stress levels can impact both diabetes management and sexual desire. Try relaxation techniques like meditation or yoga. Get enough sleep. Poor sleep can affect blood sugar levels and libido. Aim for 7 to 9 hours of quality sleep each night. Be patient and persistent. Improving sexual health might take time. Don't get discouraged if you don't see immediate results. Remember, sexual health is an important part of overall well-being. If you're experiencing issues, you're not alone, and there are solutions available. Work with your healthcare team to find the best approach for you. With the right strategies and support, many people with diabetes can maintain a satisfying and healthy sex life. Now, here's something that might surprise you. Women with diabetes are more likely to experience depression than men with diabetes. This isn't just feeling a bit down. We're talking about clinical depression that can seriously impact your life. The reasons for this aren't entirely clear, but it could be related to hormonal changes, the stress of managing a chronic condition, or other factors. If you are feeling persistently sad, hopeless, or uninterested in things you used to enjoy, it's important to reach out for help. Depression is a significant concern for people with diabetes, affecting both their mental and physical health. The relationship between diabetes and depression is bidirectional, meaning each condition can contribute to the onset and worsening of the other. Let's explore this complex relationship and discuss strategies for managing depression in the context of diabetes. People with diabetes are 2 to 3 times more likely to experience depression compared to those without diabetes. This increased risk is due to several factors, including the daily stress of managing a chronic condition, the impact of diabetes on physical health, and the potential for diabetes-related complications. Depression in people with diabetes can lead to poor self-care, which in turn worsens blood sugar control and increases the risk of complications. Symptoms of depression can include persistent sadness or irritability, loss of interest or pleasure in activities, feelings of guilt or worthlessness, fatigue, difficulty concentrating, changes in sleep patterns, and thoughts of death or suicide. These symptoms can overlap with those of diabetes, making it challenging to distinguish between the two conditions. One of the key factors contributing to the high prevalence of depression in people with diabetes is the impact of the disease on quality of life. Diabetes can lead to complications such as neuropathy, kidney disease, and cardiovascular issues, which can cause chronic pain and disability. These complications can make it difficult for individuals to maintain their usual activities and social interactions, leading to feelings of isolation and depression. Additionally, the constant need to monitor blood sugar levels, adhere to a strict diet, and manage medications can be overwhelming and contribute to stress and anxiety. This stress can further exacerbate depression, creating a vicious cycle that is difficult to break. Managing depression in people with diabetes requires a coordinated approach that addresses both the physical and mental aspects of the disease. Here are some strategies that can help. Regular screening. Regular screening for depression is crucial for people with diabetes. Tools like the Patient Health Questionnaire, PHQ-9, can help identify depression early, allowing for timely intervention. Healthcare providers should incorporate depression screening into routine diabetes care. Integrated care. Treatment for depression and diabetes should be integrated. This means that healthcare providers should work together to address both conditions simultaneously. Coordinated care can improve outcomes for both depression and diabetes management. Medication management. Antidepressant medications can be effective in treating depression in people with diabetes. However, it's important to choose medications that do not interfere with blood sugar control. Healthcare providers can help determine the best medication options. Psychotherapy, cognitive behavioral therapy, CBT, and other forms of psychotherapy can be effective in treating depression. Therapy can help individuals develop coping strategies, improve problem-solving skills, and address negative thought patterns. Lifestyle changes, regular physical activity, a healthy diet, and adequate sleep are important for managing both diabetes and depression. Exercise, in particular, has been shown to improve mood and blood sugar control. Social support. Building a strong support network can help individuals manage the emotional challenges of diabetes. Support groups, family, and friends can provide encouragement and understanding. Stress management. Techniques such as mindfulness, meditation, and relaxation exercises can help reduce stress and improve mental well-being. Stress management is crucial for maintaining good blood sugar control and reducing the risk of depression. Education and self-management. Educating individuals about diabetes and providing tools for effective self-management can empower them to take control of their health. Knowledge about the disease can reduce anxiety and improve confidence in managing diabetes. Regular follow-up. Ongoing follow-up with healthcare providers is essential for monitoring both diabetes and depression. Regular check-ins can help adjust treatment plans as needed and provide continued support. Addressing comorbid conditions. Managing other health conditions, such as thyroid disorders or neuropathy, can also help reduce the risk of depression. Comprehensive care that addresses all aspects of health is important for overall well-being. In summary, depression is a common and serious concern for people with diabetes. The bidirectional relationship between the two conditions means that effective management requires a holistic approach that addresses both mental and physical health. Let's switch gears and talk about a uniquely female complication, gestational diabetes. This is a type of diabetes that shows up during pregnancy and usually goes away after the baby is born. But here's the kicker: women who have had gestational diabetes are at a much higher risk of developing type 2 diabetes later in life. So, if you've had gestational diabetes, it's super important to keep an eye on your blood sugar levels even after your pregnancy is over. While gestational diabetes can't always be prevented, you can take steps to reduce your risk. Maintain a healthy weight. Before getting pregnant, aim to reach a healthy weight. If you're overweight, losing even a small amount of weight can reduce your risk of gestational diabetes. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Regular exercise, physical activity helps your body use insulin more efficiently. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, swimming, and prenatal yoga are great options. Healthy eating habits. Adopt a healthy eating plan that focuses on whole foods, such as vegetables, fruits, whole grains, and lean proteins. Limit your intake of sugary snacks and beverages, and avoid highly processed foods. Monitor weight gain during pregnancy. Gaining too much weight during pregnancy can increase your risk of gestational diabetes. Work with your healthcare provider to determine a healthy weight gain goal based on your pre-pregnancy weight. Avoid smoking. Smoking can increase your risk of gestational diabetes and other pregnancy complications. If you smoke, seek help to quit before or during pregnancy. Management. If you are diagnosed with gestational diabetes, managing your condition is crucial to ensure a healthy pregnancy and delivery. Here are some strategies. Monitor blood sugar levels. Regularly checking your blood sugar levels helps you understand how well your management plan is working. Your healthcare provider will guide you on how often to check your levels and what your target ranges should be. Follow a healthy diet. Work with a registered dietitian or diabetes educator to create a meal plan that helps control your blood sugar. Focus on balanced meals that include a mix of carbohydrates, proteins, and fats. Pay attention to portion sizes and avoid foods that cause blood sugar spikes. Regular physical activity. Continue to stay active during pregnancy, as long as your healthcare provider approves. Exercise helps lower blood sugar levels and improves insulin sensitivity. Safe activities include walking, swimming, and prenatal yoga. Medication. In some cases, diet and exercise may not be enough to control blood sugar levels. Your healthcare provider may prescribe insulin or other medications to help manage your blood sugar. Regular prenatal checkups. Frequent checkups are essential to monitor your blood sugar levels and your baby's health. Your healthcare provider will adjust your treatment plan as needed and check for any complications. Education and support. Educate yourself about gestational diabetes and seek support from healthcare professionals, support groups, or online communities. Understanding your condition and having a support system can make managing gestational diabetes less overwhelming. Postpartum care. After delivery, your blood sugar levels will likely return to normal. However, having gestational diabetes increases your risk of developing type 2 diabetes later in life. Continue to follow a healthy lifestyle and get regular screenings to monitor your blood sugar levels. By taking these steps, you can effectively prevent and manage gestational diabetes, ensuring a healthier pregnancy for you and your baby. Always work closely with your healthcare provider to create a personalized plan that meets your specific needs. Another area where women face unique challenges is in the diagnosis of diabetes. Women often develop type 2 diabetes at higher body mass indexes than men do. This means that a woman might have diabetes even if she doesn't look overweight by traditional standards. It's a reminder that we can't always judge health by appearance alone. Now, let's talk about some of the sneaky ways that diabetes can affect women's bodies. Did you know that diabetes can mess with your period? Yep, it's true. Women with poorly controlled diabetes might experience irregular periods or even stop having periods altogether. This can obviously cause problems if you are trying to get pregnant, but it can also be a sign that your diabetes isn't well controlled. Speaking of pregnancy, women with diabetes face some unique risks when they're expecting. They're more likely to have complications during pregnancy and delivery, including a higher risk of miscarriage and birth defects. But don't let this scare you off if you want to have a baby. With good blood sugar control and close monitoring by your healthcare team, many women with diabetes have healthy pregnancies and babies. Let's circle back to heart health for a moment. We talked earlier about how women with diabetes have a higher risk of heart disease, but did you know that the symptoms of a heart attack can be different in women? While men often experience the classic chest pain, women might have more subtle symptoms like shortness of breath, nausea, or pain in the jaw or back. This means that women need to be extra aware of these less obvious signs and not hesitate to seek help if something feels off. Now, here's something that might surprise you. Women with diabetes are more likely to develop eating disorders than women without diabetes. This might be because of the intense focus on food and body weight that comes with managing diabetes. If you find yourself obsessing over food or engaging in unhealthy eating behaviors, it's important to talk to your healthcare provider about it. Let's talk about a complication that affects both men and women, but might progress differently in women: neuropathy. This is nerve damage caused by high blood sugar levels. In women, neuropathy might progress more quickly and cause more pain than in men. This can affect your quality of life and make it harder to stay active, which is so important for managing diabetes. Now, here's a bit of good news. While women face some unique challenges when it comes to diabetes, they also tend to be better at managing their condition than men. Women are often more proactive about their health, more likely to stick to their treatment plans, and more willing to make lifestyle changes to manage their diabetes. So if you're a woman with diabetes, give yourself a pat on the back for all the hard work you're doing to stay healthy. Let's wrap this up with a call to action. If you're a woman or man with diabetes, or if you think you might be at risk for diabetes, don't ignore the signs your body is giving you. Pay attention to unusual symptoms, keep up with your regular checkups, and don't be afraid to speak up if something doesn't feel right. Your health is worth it. Remember, while diabetes can be a challenging condition to manage, especially for women, it doesn't have to define your life. With good care, support, and the right information, you can live a full, healthy life with diabetes. Stay informed, stay proactive, and most importantly, stay awesome. Always work closely with your healthcare provider to create a personalized plan that meets your specific needs.